Good evening, my friends. I am back to complete our topic muscles relaxant. In previous lecture, I described about succinylcholine. Now, I will describe about some drugs separately, but not all. I will only describe important drugs. Decamethonium, you don't need to know anything about decamethonium, so forget it. Just remember decamethonium is depolarizing non-competitive blocker, just like succinylcholine. And among depolarizing blockers, you should know which blockers are the duration of action. Long acting at a tubocuranin, doxacuranin, pancuranin. Intermediate acting VAR, vacuronium, atracuronium, rocuronium, and galamine. Short acting mivacurium. Among these drugs, the most potent, powerful muscle relaxant is doxacuronium. Okay. Now I'll talk separately about vacuronium, atracuronium, few things about rocuronium and galamine because they are very important and question will be asked from these topics. Get into the vacuronium. Look, vacuronium, what thing you should know about vacuronium? You don't need to know dose. Vacuronium is the most cardiovascular stable drug. It is the most cardiovascular stable drug. So muscle relaxant of choice for cardiac patients. What do you mean by cardiovascular stable? Means it will not have any effect on heart. It is not cardiotoxic. It will not interfere with the working of heart. Understand? Look, about metabolism, vacuronium, it's important about its metabolism. Look, it is metabolized in liver and 40% is excreted in bile. So that is why this drug should be avoided in case of biliary obstruction. If a patient is having some gallstones, stones in the common hepatic duct, or if he is having some tumor of pancreatic head, this drug should be avoided, vacuronium. And this drug is the drug of choice for cardiac patients. Okay, about rocuronium, you just need to know about its injection is painful and it is used in rapid sequence induction. Look, in rapid sequence induction, two muscle relaxant is preferred. One is succinylcholine that I forget to mention in my previous lecture, and another is rocuronium. So what do you mean by rapid sequence induction? Rapid sequence induction means it is used in case of patient we have high chances of gastric aspiration. We have high chance of gastric aspiration. What we will do, we'll give pre-oxygenation, means we'll give patient with 100% oxygen, and then we applied cricoid pressure. Cricoid pressure means Selhick Manbeer. Cricoid pressure means we'll press his cricoid cartilage so that it will press on esophagus and occlude it so that aspiration of gastric content does not happen. Okay, and we'll give succinylcholine or rocuronium and will then finally intubate patient. This is called rapid sequence induction. Okay, let's move into atracurium. Atracurium, very important drug. Lot of questions can be asked from atracurium, but you can forget everything about atracurium, but don't forget about Hofmann degradation. It is the only drug that undergoes Hofmann degradation. Means the drug will not excrete through your liver, will not pass through your kidney. The drug gets spontaneous degradation in plasma. Drug will disappear in plasma by some magical mechanism. This is called Hofmann degradation. Since this drug did not need to excrete through your liver or kidney, you can use this drug. This is the best drug to use in case of hepatic failure or renal failure. What happens when you use other drugs in case of hepatic or renal failure? Those drugs will not excrete through your body. They keeps rotating, they keep circulating in your systemic circulation and may cause toxicity. That's why atracurium is preferred in case of hepatic and renal failure. But every action, everything has plus and minus. What are the minus of atracurium? Look, atracurium causes release of histamine like in anaphylaxia, and this histamine will cause bronchospasm since it is a potential bronchoconstrictor, and hypotension just like in anaphylactic shock. Histamine release, one minus, and another minus is convulsion due to metabolic product laudanocin. Convulsion due to metabolic product. So epileptic effect. Look, in whole anesthesia, three drugs, you know IKEA, just remember IKA. So this is influran, ketamine, and atracurium. These three drugs are epileptic. They can cause convulsions in whole anesthesiology. Look, another drug, atracurium, brother of atracurium, cis atracurium, is more mature, means he has more plus. This cis atracurium will not cause release of histamine. So these problems will not happen when you use cis atracurium. And another plus about cis atracurium is this drug is 4 times more potent than atracurium. Another drug, galamine. Galamine is mainly excreted by kidney. So these drugs should not be used in case of renal disease and pregnancy. But atracurium should not be used in case of hepatic failure, renal failure, because should be used. It should be used. This drug should not be used. Look, most potent muscle relaxant, doxycycline. Least potent, succinylcholine. Least potent among non-depolarizing, rocuronium. And most commonly used in routine surgery, atracurium. Okay. Let's just look at the question. Atracurium is the only muscle relaxant that undergoes Hoffman degradation. It gets metabolized in, of course, plasma, not liver, not kidney. Look, cis atracurium is preferred over atracurium due to advantage of, I told you, no histamine release because this is bada bhai. Another question. Look, the ideal muscle relaxant used for neonate undergoing portoenterostomy for biliary atresia linked with liver. In case of liver and kidney function deterioration, we use atracurium. Look, I told you something about malignant hyperthermia. What is this? This is a congenital disease that is transmitted through autosomal dominant method, and this disease will not manifest until it is triggered by some factors, and the triggering factor is usually succinylcholine and inhalational general anesthesia. What did they do? You know, the sarcoplasmic reticulum. In sarcoplasmic reticulum, the depot of calcium. Here is the ryanodine receptor. Yeah, something like ryanodine receptor. These drugs activate it, and it causes release of calcium to the muscles. So the intracytoplasmic calcium contraction increases, and muscles keeps contracting, severing. So it will cause release of. So it will cause what? Thermoproduction. The heat will be preserved, and the temperature will rise. Sometimes even cardiac arrhythmia may happen. Cardiac arrest may happen. So to treat these drugs, as we know, the pathogenesis, we will use this ryanodine receptor blocker, and as I told in my previous lecture, the only blocker of this receptor is dantrolene sodium. So I almost discussed everything that you should know about muscle relaxant. I read some Indian books, and I don't find something more than this. If you study this with concept, is it enough for muscle relaxant? So watch my videos, like it, subscribe it. Bye bye my friends, good luck.